Yes, the global pandemic generally has exposed some weaknesses in the health system generally, and in Nigeria it's not an exception. We have found areas where we are weak, and I think to some extent those areas are being strengthened so that subsequently we don't pray for such to happen, but if it does, we should be able to handle it much more confidently than how it happened this time.
Okay. How has this center managed efficiently and effectively within your weaknesses and your strengths as well to manage this pandemic?
Yeah, the way the pandemic came, actually it came at a point that people were not expecting it to be that serious. And when it came, there was a lockdown, and that affected so many things, including the health system. It also came at a point that the health workers were not too knowledgeable about the virus itself. So a lot of new things were coming up. Now, how to protect yourself is one aspect of it. The other thing is how to give service to the other while doing that. So that challenge came in, and we thank God we were able to manage that very well. We had a series of trainings in which we gave our staff. We collaborated with the CDC. They came and gave some workshops on how to do that. So that's done, and we're able to also find areas where we do triage. If a patient comes into the hospital, we'll be able to now triage. This is likely this is likely that. So we're able to do that triage to reduce the risk. And it's good to know that very few of our staff really had COVID throughout all this, and we thank God that we didn't lose a single. Yes, I think the government did well. They were able to come up with PTF, which actually responded to most of the needs in terms of trainings, in terms of provision of PPEs. They were able to do so, and some funds were able to be. They were able to bring some fund on the table, and it has been appropriated at the moment. At present, there will be establishment of molecular laboratories in virtually every federal tertiary health institution in this country. Apart from that, there is also the strengthening of ICUs. There is also strengthening of our isolation units, and also provision of PPEs. All these monies have been appropriated for, even though they have not been released fully, but at least something has been done. And on the side of the healthcare workers, in the hazard allowance, the special hazard allowance has been paid to them, and I think those that are outstanding will soon get paid. So I think that also boosted the morale of the healthcare workers who put themselves in the line of this current challenge. So that is being done. So I think largely I can say the government has done well and is currently doing much more to see that this pandemic is properly managed. Yeah, generally this pandemic, like we said, it came at a point that nobody was expecting it, and the way it came, it's a virus, completely a new virus that nobody really understood. It's with time that some basic researches were going on, and then we are beginning to understand the virus. So as of now, I think much has been known about it, but still we are expecting much more in relation to maybe vaccination, on how to prevent it and all that. But in the meantime, we can do the basic things like protecting ourselves using the face masks, and then taking other precautions like washing your hands and all that. It's quite a challenge. It's the new normal now, and I believe we just have to live with it for a while. Economically, the world has suffered because of lockdowns and what have you. A lot of companies have closed down, some laid down their staff remaining only very few and all that. So it's quite a challenge that will take time to actually take care of all this. And if you notice now in the West, there is a second wave of this pandemic. Sadly, it's going back to the way it came. You know, more and more people are coming down, more and more deaths are being recorded. But in Nigeria, so far so good. I think our curve is still going down. We pray and hope that it will continue in that direction, and we also plead with people to actually take the necessary precautionary measures in order to keep the curve down so that we will not have a resurgence of this pandemic. Yeah, it was quite challenging. You see, as for me, I think the pandemic, the lockdown started shortly after I came in here. I came in February, and I think by March or April or so, and there was that lockdown. And that means that your overhead remains the same. But what you generate goes down, because we had to close down virtually the whole hospital, and we left only the emergency services that were running. And with that, it was so difficult to manage. But we thank God that the measures that we put in place, because at a point, even the staff, we had to now batch them. Okay, you come today, another batch come tomorrow, so as to reduce exposure. And but the revenue generally went down, but we were able to pull through, and I think things are beginning to normalize now. But still, we cannot say that we are back to where we were. But things are okay. We are open fully to attend to every health challenge. Unlike those times when you just come and you'll be told that it's only emergencies and maybe a few other medical conditions were being attended to. It was a real challenge. We have never envisaged that there will come a time where we have this kind of situation. But I think we are better informed, and like I said, it exposed the weakness in the system. But I believe if for any reason, we don't hope to get, but if for any reason we have similar thing, I think we have learned so much from this in order to give our best subsequently.
Thank you very much, sir.
Thank you.